one or two comments, and then we'll move to the next session. Has anyone gotten acupuncture paid by MSP or provincial health insurance plans? Yeah, good. Sorry, we have a comment here in the front row. Just introduce your name again.
Hi, my name is Kay. I'm undergrad student at SFU. I don't know if I'm directly answering that question, but I just have a comment from listening all the talks. And this morning, I heard a conversation at the SkyTrain on my way to SFU, and it was interesting, so I'd like to share. So the one gentleman was talking about Japan, and then he was talking to his colleague, seems to be. He was talking about Japan, and he was saying, so what do you think about Japan? And his colleague said, that's sad. And I was like, it's interesting, because he said, just sad. But if you think about it, this kind of catastrophe happening everywhere in world. We saw flood in Pakistan, we saw earthquake in China, we saw earthquake in also New Zealand. It's happening everywhere. It's just, as much it sounds depressing, it's happening everywhere, and it seems to me, came to be conversation in case in Japan, because there's a media coverage, so much media coverage and so much stories. I think I have liked to say this because I'm Japanese and I really appreciate media attention, but at the same time, I just feel that that's something that creating a boundary. Just because Japan had earthquake and Japan is one of the industrial country, it doesn't mean that Japan deserves attention. We also have to talk about, the people we don't focus much, and other word. And yeah, that's what I thought about. And also, just to add, I just think that there's so much constraints in world, also in the not only the health side, but like the medicine side. So if we talk about the pharmaceutical companies, why there's so many restriction, the people who deserve the medicine don't get the medicine, whereas people who don't, I don't say don't deserve, but people who suffer from hypertension get the medicine just because there's more demand and they have money to buy medicine, whereas people who suffer from HIV doesn't get treatment. So there should be justice done. That's what I feel. Thank you so much.
Thank you, Kay. We'll let maybe 2 quick points. Are they going to be quick? Because then we should move on. So we'll go Amita and then the woman in the back. Yeah.
I'll be rapido. I work for QSO VSO, and we have a diaspora program in the health sector, sending health development workers overseas in a sustainable program where they are teaching people from the countries that they came from. Talk about difficult recruitment. We can probably recruit more healthcare sector workers amongst the Canadian population that aren't diaspora than diaspora. So I'm saying it's a great idea and a great notion, but it's challenging because the pay is incredible here. They'll spend 2 years or a year overseas with very little pay, but I must say those that do it and come back are very inspired. So it's not just the service we do overseas, it's the ideas and the culture they bring back. For example, alternate medicine and different herbs and stuff from different countries.
Thank you, Amita. And
my name is Nazra Meyer, and I am a youth worker and a community worker and a diaspora from Somalia, and I do work in Uganda, Tanzania, and Kenya. I just wanted to highlight the fact that we talked about several things connecting to global health in the sense of climate, like livelihood and displacement, but we didn't really touch on youth, and youth have such an impact on our world and how it's changing. And my question really to everyone is, what are we doing to educate youth on global health?
Thanks. Let's hold that thought. And Joanna, I guess you're going to be opening up the next portion, which is questions to the group as well around diasporas.
Nazra, I think it is a great question. We can pick up that question, and maybe as we think about this bridging effect, in some of the research, James Wasuti-Sam, our political scientist here at SFU. James, where is he? He's gone. And Bob Anderson, we've been doing some research on this notion of the looping back effect. That, in other words, not just thinking about diaspora working translocally somewhere else, but that this is a relationship. That this and John Tinker is here too, and he's going to say something a little bit about the commonality lens. Earlier, Dr. Spiegel talked about the working with, not for. It's this mutuality. So I think that in some ways, talking about youth and how to educate the youth, I think we can see if we can weave that in some of the stories that we hear about this bridging. Because I think, Nazra, in a way, you're such a perfect example of a young person who's working in Metro Vancouver and taking your energy and your talents and sharing and learning from the communities that you're working with in Uganda and elsewhere. So, I mean, I think you, in a way, you are the answer to that question. You're a living example of that bridging. And that's a really way, I'd like to move into that question. How are diaspora transcending boundaries and serving as a bridge between the global north and the south? And what's the impact of these translocal interactions? And in transforming our health practices, I think Lauren's example of our health practices are being transformed in really marvelous and expansive ways. And our systems are benefiting so much from them. And as we've heard from some of the stories, systems elsewhere are also benefiting from this mutuality. So in that theme, we'd like to hear your thoughts. And then I'm also going to ask John Tinker to say a little bit, if he's still here. He had to leave? Oh, well, we'll explore this notion of mutuality. And Nazra, I don't know if there's anything else you want to say about the work you're doing. I don't know if it's related specifically to health, but I know you're working with young people and you're doing education work.
I just want to say that a lot of the work that I do is empowering youth, providing skills within media in that capacity. But I feel like global health has such an impact on youth, and in that capacity, and us being in East Africa, that's we see the diseases and a lot of health concerns. And it'd be really good for a lot of youth workers and youth to have a real understanding of the global health, so that we can really use that towards the work that we're doing. So I don't know. Thank you, Joanna.
Okay. So see what else people are thinking about in terms of thinking about this mutuality lens and the interactivity, this relationship that we seem to be creating. Yes. Is it Jean?
Yes.
Yeah.
When I look that question, how are diaspora transcending boundaries and serving as a bridge between the global north and the global south? I was really thinking something come to my mind. 2 years ago, I was watching European Union Assembly discussing about diaspora, professional diaspora in Europe. There was one guy asked the question that in Europe, they have 50,000 African professionals work in Europe. And in North America, I don't know what the number is. And how, like, there are some African or diaspora people we put in the front to say, oh, this is doing well, is a black, is Asian. However, there is 1,000 underdog working in our communities. And that bridge is really existing. Is really government, especially like I'm Canadian, I can talk our government Canada. Is really a government like Canada take a consideration and understanding the richness of diaspora people we have here in our communities and who are working underdog That's my question.
Thank you. Would anyone like to respond or link up to Jean's comment? What I'm hearing from your comment is that as a Canadian society and our formal systems, that we need to be really recognizing the work that diaspora is currently doing. Does that capture?
Usually, like, it's very easy. I'm sorry if I'm using these terms because they are existing. It's very easy, the Canadian government, to embarrassing a project done by a white person and support that project and encourage it and say it's so good, so smart, so interesting. And another person, the same level, the same understanding, maybe the black, and he said, I understand the language, understanding the culture, I have been there, I've been trained here, I live there. I am the best person to do that job. And most of the time, the government will turn down most of those people. That's what I'm saying, is that many people in diaspora groups have been tried, and the government put them down. That's the things.
Right. Okay. So I think we understand your point. And
Yes,
would anyone like to respond to that? Yes, Dr. Zaman.
I'm not responding, but this is a very important issue raised, I guess. When you talk about diaspora in development in the South, if I consider myself as a part of the diaspora, the gentleman who was speaking from Kenya, the Canadian government, through its work and international development work, aid and assistance, should involve the diaspora more into those countries. There is something probably lacking at this point, and this is why he's raising this point. That does not necessarily exclude the non-diaspora population in Canada in international development, but there should be sort of a turnaround, I guess. That is lacking right now. It is more of a bureaucratic, official approach, and bringing one or two people from within the country to assist in the project planning and management. And I particularly want to bring the attention of CEDAD, at this point, involving more of the diaspora people in Canada in the development of the South, because there is a lot of expertise in this country also as Canadians, like myself and anybody else here, or someone like Dr. Pirani, or any other people, so the point that I'm trying to say is that there should be a policy issue that should be discussed, raised, and incorporated in the Canadian international assistance policy. This is a valid point in my view. Thank you.
Okay, thank you. So I think Jerry and Shafiq?
Just briefly, I think it's a fundamentally important point to look at how you affect change. And the thing that's been encouraging, there's been a bit more recognition of some of the challenges. There's even been, it raises the question, what's knowledge? If we had this very kind of narrow frame of knowledge, it encouraged the kind of difficulties that the questioner was describing. But I think there's increased recognition of something that some people are calling implementation science. Once you start to look at how you actually affect change, you start to recognize the values of the strengths you described. So I think we haven't gone far enough to really incorporate that. But I think, I found it encouraging that at least there's some rhetoric that recognizes it. We have to go a little further and walk the talk.
Great, that's an interesting point. Shafiq, and then there's a couple of people over there, and then we're gonna have to wrap up. We're gonna take maybe one other comment after.
I just have a question. It reflects on statements that I've made just in the last few minutes. What then constitutes an enabling environment for diaspora to sustainably address the issues that are relevant to the South? And how do those get answered? Because I don't think they've been measured. And if they're measured and the value is put on them, then others may respond appropriately.
Yeah, it's an excellent question. And I think that, without losing the question, we might be, now we're getting into the final wrapping up. And, sometimes after such a big conversation with many different threads, we want to try and bring it to close, but in a sense, the best kind of dialogue is one where we are left with more questions, in a sense, than answers. We probably, in a sense, this idea about the bridge and the commonality lens, I think we can probably move past that, but let's stay with that question. What's the enabling environment? And maybe people have some ideas about what that enabling environment is. I think each of you who have told your stories, and others of you that are doing this work through a diaspora lens, I'm sure you know it, and it may be that kind of tacitly known knowledge, but maybe we could try to name some of the things that are enablers for the work that you've done already. Okay, so Shafiq, do you want to just
I'll quickly answer
finish
this
that
one.
thought, and then I'll call on.
The enabling environment for the work that I'm doing is actually the Canadian government, through the Canadian International Development Agency, through a program that was put together by the agency where they could harness universities' intellectual capacity to answer the problems of poverty in the third world. So, but that was put together, I believe, because universities made the case that we have something to contribute. I think the diaspora should make the case that they have something to contribute, but in a way that is cohesive.
Okay, that's a great point. So I'm going to call on this gentleman here, and then Stephen.
Hi, I'm a physician from India and working here for a few years. I work in Royal Columbian Hospital.
I don't want to interrupt, but it has to be really brief.
Okay. And, no other time in the history we have so much opportunity to do such a good thing, including utilization of all modern information systems, including internet. For example, anybody can have, the basic things in Punjabi here, and 100 million people can access it from anywhere in the world. And we have such a good dialogue here, but a lot of times dialogue stops here, and I wish it won't be, because one of the good ideas should be that to have some kind of global forum for any of us, including diaspora, to take interest in it. Thank you.
Yeah, thank you very much. And Stephen, it might give you the last word before we wrap up. Thanks.
Wow, pressure. So just also to address your question about the enabling environment, for you it was the Canadian government. I just wanted to share really briefly that when my peers and I decided to start our organization, there was a lot of criticism that you're young adults, all you guys do is study, and just why would you care about other things in the world? So I think for me, a big part of the enabling environment was getting a group of people together to advocate for our cause. On the one side, there is the government, but on the other side, it's also on us to advocate for whether it's retainment of physicians in our countries or for global health issues or sustainability. These things are things that we need to advocate, and it's on us to do as well.